Welcome to our project, South Korea Healthcare System, presented by Sarah Marchant, April Martinez, Emily McDaniel, Pamela Miles, and Tierra Oles. Next slide, please. I will discuss the financing aspect of the South Korea healthcare system. The funding is a combination of both private and public funds. The statistics data that I gathered during my research is based on information provided by the World Health Organization. It primarily consists of public financing, which is approximately 55%. This funding is generated from tobacco tax revenue and government subsidies. The government provides a national healthcare insurance, which is a universal healthcare program. And recently, the healthcare reform in South Korea added a long-term care service coverage to that. The secondary form of funding is from private sources, which includes the largest percentage out-of-pocket payments, and a portion is provided through private health insurance at 4%, and the remaining 5% is through private charity organizations. And that basically covers and explains where the money comes from and the sources. Thank you.
Okay, so the next slide I am going to present is public versus private hospitals and who dominates in the South, which one dominates in the South Korea healthcare system. So just a little bit about both. Public hospitals serve as a safety net for more rural cities and lower income families. Public hospitals focus on outreach programs, preventative measures, and focus on improving the community so less patients use the hospitals. They also serve as medical training and contribute to conducting research. And then for the private hospitals outnumber public ones by a significant margin. They are more accessible, especially in urban areas, and offer a wide range of medical services. Private hospitals often lead in specialized medical fields such as plastic surgery, dermatology, and advanced treatments. They tend to invest heavily in modern equipment and technology. Many patients prefer private hospitals due to perceived higher quality of care, shorter waiting times for non-emergency treatments, and better amenities. So in South Korea's healthcare system, neither public nor private hospitals dominate. They both play an important role. Public hospitals focus on more preventative programs, which help improve the doctor to nurse to patient ratio. And in contrast, private hospitals address a wide range of necessary medical needs. And this is the end of my presentation portion.
According to worldhealthsystemfacts.org, in South Korea, physicians and hospitals can be paid one of two ways. The first being a fee-for-service system. This system is the provider is paid a fee for each service that they provide a client. Another pay method is the diagnosis-related group perspective payment. Acute care providers have 7 different disease categories that they have a specified fee that they receive once they're treating clients for those diseases. And then for long-term care hospitals, there is 17 different disease categories that providers are paid a certain fee when they treat those disease categories.
Are physicians and nurses employees of hospitals, or are they independent practitioners? So in South Korea, doctors typically work in private practices or are employed by hospitals that are privately owned. Nurses are typically employees of hospitals or practices as well. South Korea takes part in a universal healthcare system. Many doctors turn to specialties such as dermatology and plastic surgery due to the fact that the public health system does not provide enough funding for essential healthcare. This being said, after the Korean War, the healthcare system was not a top priority for the country. Doctors turned to making their own independent practices, which led to the majority of clinics and hospitals today being privately owned. This year, South Korea implemented a new policy that would greatly increase the number of medical students being accepted. This will lead to a very abrupt increase in the number of medical students, which schools and hospitals will be unable to handle on such short notice. This led to a walkout of over 90% of South Korea's 13,000 medical interns and residents. The government was planning to revoke the licenses of anyone who refused to return to work. But the protesters stood their ground, and the government agreed to slowly increase the number of students accepted gradually over several years.
So, citizens' perspectives on South Korea's healthcare system. So, citizens share the tax burden to support the healthcare system. About 5% of pay is deducted from monthly salaries, while low-income people are exempt. Whenever it comes to health insurance, patients are still expected to pay for a portion of the bill. Many decide to choose additional private medical insurance, which leads to healthcare spending being higher than average. Whenever it comes to access, increase in time when it comes to medical services available in both rural and urban areas. In rural areas, it tends to be overcrowded and limited in services, whereas with urban, the wait time for specialty doctors is high. Whenever it comes to the aging population, society is getting older while birth rates remain low, which places a financial burden on the government. In illnesses, they tend to pay more attention to treating illnesses rather than stopping them before they start, which uh, it doesn't reduce long-term health effects or medical spending.
Okay, so just to summarize the presentation with the pros and cons of South Korea's healthcare system, the pros is a mix of public and private hospitals. A mix of public and private hospitals provides flexibility and choice for patients. Access to universal health care, cost is significantly low compared to other developed countries, and then well equipped with advanced technology. So they have high MRI machines and CT scanners per capita, and they're well known for treatment of skin diseases and high cancer survival rates. The cons for this healthcare system is the disparities in access to care, especially between urban and rural areas, insufficient government funding for essential healthcare providers, and although long-term care has been added, the overall scope of covered services is still limited, resulting in private OOP. Focus on treating illnesses rather than stopping before they start. So that will conclude our presentation. Here are our references for where we found our information, and I hope you enjoyed. Thank you so much for watching.